Scoot this just a little bit this way. We're testing 1, 2, seeing if we can pick up sound. Hoping it picks up sound. We'll find out in a moment. I'll just kind of repeat this. Hello, Mr. J. Nice to meet you. My name is Ann Jeanette, and I'm a registered nurse, and I work closely with Dr. Davis. You and I are going to meet briefly today, and then Dr. Davis is going to talk to you about your upcoming surgery. I am your nurse navigator, and my role here is to assist patients in navigating through what can be at times a somewhat confusing process when going to appointments or getting lab work done, or going through procedures when someone is first diagnosed with colorectal cancer. You may at any one time find several providers being involved in your care at the same time, and I will be there to ensure that we are all communicating with each other to provide you with a very personalized and seamless care. I'm here to be a resource for you for any questions that you may have or that you may have forgotten to ask your doctor. I can also get information for you regarding any resources you and I may find that could be beneficial to you as well. So here's my card with my cell phone number. I will be contacting you periodically, but wanted to make sure that you also have my number to call me as well.
Okay.
Before we get started, I would like to review some things that I noted in your medical chart. Can you tell me how old you are?
I'm 72 years old.
And it looks like you currently have high blood pressure and take atenolol 25 milligrams daily for this. And you also have high cholesterol and take Lipitor 80 milligrams daily for this. Is that right?
Yes.
So you also take baby aspirin 81 milligrams per day?
Yes.
Any vitamins or herbal supplements?
I take a multivitamin when I remember and a vitamin E sometimes, but no herbals.
You also have arthritis, but you do not take anything for this.
Sometimes Motrin, but not very often.
So you recently were fitted with a hearing aid?
Yes, in my left ear, and I hear so much better now.
So it also looks like you had a recent eye exam, and that all looked good, with some mild cataract seeing, but no glaucoma, and you only need reading glasses. Is that correct?
Yes, that's right.
Any issues with urination, beginning your stream, difficulty urinating, painless, anything like that?
No.
Okay. Any issues with any decreased smell or taste that you've noticed?
No.
Any issues with memory loss or having impaired judgment?
No, as a matter of fact, my primary physician's office did a screening a few months ago and everything was great.
Great. Okay, any issues with feeling depressed or hopeless?
No, I'm saddened by this diagnosis and wish it had not happened, but I'm ready to fight this and get on with my life.
That's great. I'm glad to hear you're feeling you can beat this. Older adults are at a greater risk of depression, and older adults with a diagnosis of cancer are at an even higher risk. So if at any time that changes for you, please call me and we can determine if that is something that we need to do something about, or if it's just related to the situation and will pass.
Okay, I will.
So it looks like you're a retired firefighter?
Yes, I am.
Do you enjoy retirement?
Yes, I have more time to do the things I enjoy, like woodworking.
Do you have any financial concerns right now?
No, I always wish we had more, but we're doing okay and have good insurance.
Well, that is good. That's mine, actually. Financial concerns can add additional stress to what is already a stressful situation. You are married with 2 children?
Yes, and 4 grandchildren, and that keeps us very busy from sporting events to dance recitals. We really enjoy it.
Oh, who else do you socialize with?
We have lots of friends, and we get together with to play cards or go out to dinner with. We are pretty active in our church as well.
That's great. Having a healthy relationships is important. Sounds like between family, friends, and your church, you have a good support system.
Yes, I feel very fortunate.
You mentioned you were active in your church. Are there any religious or spiritual beliefs that I may need to be aware of, such as healthcare practices or end-of-life care?
No, nothing I can think of.
Okay. Have you filled out any forms regarding advanced directives?
Not yet, but I have them, and my wife really wants me to fill them out.
Well, they are important, especially if something were to happen to you and you were not able to communicate. They tell your wife and your family what your wishes are and makes it easier for them to follow what you want.
Sounds good. I'll get them done.
So tell me about your diet. What types of foods do you typically eat?
Well, I like steak and pretty much all red meats. I don't care for vegetables too much, and I only eat a little bit of fruit. The foods I probably a bit high in fat as well. But that's what makes them taste so good.
How about fluid? What would you say you drink in a day?
3 to 4 glasses maybe.
Do you smoke?
Yes, but I'm trying to quit. My wife hates it.
Do you drink alcohol? And if so, how much?
Yes, but not as much as I used to. I drink maybe 4 to 6 drinks per week, during football games and stuff.
How about physical activity?
I lift weights twice per week and walk or swim 3 days per week, although I don't do it for very long, especially now that I'm so fatigued. The doctor told me that this is because of the blood loss I have been having. When I got my knee replaced a few years ago, my doctor said it was important to keep it moving.
Sure, that is understandable, and that fatigue will get better after surgery once the bleeding inside has been stopped, and those red blood cells build back up and are able to carry more oxygen around, which will give you some additional energy. As we age, our bone mass declines and can become easier to break. By lifting weights, you actually are slowing that process and possibly preventing it. So physical activity such as walking and swimming is good for you, but also important for the rest of your body, like your heart and your lungs. So keep up the good work. You came in to see your primary care physician due to concerns with some blood in your stool, having some fatigue, and also looks like you had a 10-pound weight loss that occurred, but you were not trying to lose weight. Is that all correct?
Yes.
Okay. So then you had a colonoscopy that revealed colon cancer. Then you had a CT scan that revealed there were no noticeable areas that cancer had spread at that point.
Yes, that's correct.
Okay. That is a lot to take in. How do you feel you were doing today with all of that information?
I'm angry and happy.
So tell me about that.
I'm angry at myself for not getting a following colonoscopy sooner, as my doctor told me to, but at the same time, I'm happy that it looks like the surgery could cure it too. I want to take better care of myself and my family, and I'm looking forward to surgery so I can start taking care of the things I need to. I just don't know where to start first.
I'm actually glad you said that. We cannot change the past, but we can change what we do in the future. I see some very specific things that I think you can do and have control over, and these will significantly reduce your risk in the future of having this cancer return, if you are interested.
Yes, absolutely. I'm ready.
Great. Well, first I'm going to take a look and listen to you really quickly, and then we will go over all of that, okay?
Sounds good.
I have taken a look at the vital signs they took just a few minutes ago, and from looking at your chart, everything seems normal for you. Your blood pressure and pulse are right where we would expect them to be with your medicine. And I also saw when you came in, you walked down the hallway, and you look like you ambulate just fine and do not carry a cane or anything else. Is that correct?
Yes.
Okay. So, timing-wise, let me see how far this is. So we'll just do this. I'm going to look at your head. I'm just going to do this. I'm going to just kind of look at your head, your scalp, looking at the color of your skin. Can you put your arms out straight for me? Can you go ahead and grab my fingers and squeeze hard? Okay. Keep your hands straight, and I'm going to, okay, look up. Just keep your hands straight, and then I'm going to push against you and try to prevent me from pushing them towards each other. Okay. And then I'm going to go inside. And, okay, perfect. All right, now I'm going to take a listen to your lungs. You lean forward just a little bit. There you go. I want you to take a deep breath in. Good. And then out. Okay. And just breathe normally. Okay, go ahead and sit back. I'm going to take a listen to your heart. Now I'm going to listen for just a minute, so just relax and breathe normally. This is going to take about 1 minute. A little shorter than a minute, but that's okay. All right. Now I'm going to take a listen to your belly. Okay. Again, just breathe normally and just listen to your belly. And what I'm doing is I'm just listening for sounds, making sure that everything is in there, is moving the way that it's supposed to be moving. Okay. Now I'm going to take a look at your feet. So you have your socks and shoes off for me. Let's see how I should do this. I wonder. You don't have to take them off right now. We'll do it next time. I think what I'll do is I'll just kneel down and do them. Then I'm just going to feel. I think I can. You can see. I'll feel down here. There's no edema. Looking at your skin color. And then. Cat refill. Okay. Well, everything looks really good. Now let's talk about those things we can work on. One of the most important things you can do is to get regular screenings. This is important because having had a diagnosis of colon cancer, that alone places you at a higher risk of getting it again. In addition, the cancer tumors usually begin as small polyps that can become precancerous and then turn into cancer. But they are typically slow growing, so by removing them when you get a colonoscopy is one of the most effective ways in prevention.
Absolutely. I'm going to get them as often as the doctor tells me to now.
You do, though, currently have some lifestyle choices that we can change to place you in even a lower risk category.
Great. More of those.
Smoking will be the first one. You said you were trying to quit. Since you are still trying, I would like to offer you some smoking cessation resources that I really think can help you. They offer the patch at a really reduced cost to you and even counseling support if you need it.
Great.
Diets that are low in fat and high in fiber and low in red meat are recommended to decrease your risk of colorectal cancer. We have a great nutritionist that works with our patients, and she has some really great ideas that I think could help you add more vegetables into your diet, so we can increase your fiber. She also has some great ideas on how to increase your fluid intake as well. She usually will meet with you once, and then we'll do some follow-up telephone visits to see how you're doing and if you need any additional support.
Okay, my wife will be happy about that.
Okay, alcohol. Although you are not a heavy drinker, which would place you at even a higher risk, decreasing the amount you drink is something you should be thinking about.
Okay, I can do that. I'll just have a few beers during the Bronco damage treatment. That's not a big deal.
Okay, I think we're done. Do you have any questions for me?
No, I think you answered everything.
Okay, well, it was nice to meet you today. You have my card. Don't hesitate to call if you think of something. Good luck to you with your surgery. Dr. Davis is wonderful. And I will call you about a week after the surgery to see how you're doing.
I look forward to it. Thanks, Anjanette.
Okay, nice to meet you.
Nice to meet you.
All right, actually, I'm going to go over here.